Hi dear students. So in the previous session we had a detailed discussion on hypersensitivity 1 and hypersensitivity 2. So today we are going to look into hypersensitivity type 3. Type 3 hypersensitivity is also known as immune complex hypersensitivity. The reaction may take 3 to 10 hours after exposure to the antigen. For example, in the case of Arthur's reaction. The reaction can also be general, as in the case of serum sickness, or it may involve individual organs or other organs. Antigens causing immune complex mediated injury are exogenous and endogenous. So now let's see the overall mechanism of type 3 hypersensitivity reaction. In this image, you can see that the antigens combine with the antibodies to form antigen-antibody complexes. After that, phagocytes remove most of the complexes, but some lodge in the walls of the blood vessels. Third, the complexes activate the complement, and then the antigen-antibody complexes and activated complement attract and activate neutrophils which release inflammatory chemicals. And these inflammatory chemicals damage the underlying blood vessel wall. As mentioned earlier, in type 3 hypersensitivity there are exogenous antigens and endogenous antigens. Exogenous antigens, infectious agents, consist of bacteria, viruses, fungi and parasites. It also includes certain drugs and chemicals. Whereas in endogenous antigens, it's mainly the blood components that include immunoglobulin, tumor antigens, antigens in cells and tissues, like the nuclear antigens in systemic lupus erythematosus. Depending upon the distribution and location of antigens, type 3 hypersensitivity are of two types. The local, that includes Arthur's reactions, and the systemic one, that includes circulating immune complex disease or serum sickness. Arthur's reaction was named by Dr. Arthur. Here the inflammation is caused by the deposition of immune complexes at a localized site, and the clinical manifestation include hypersensitivity pneumonitis. In systemic reactions, the serum sickness is a systemic inflammatory response to deposited immune complexes at many areas of body, and it occurs few days to 2 weeks after injection of foreign serum or drug, and also it results in fever, urticaria, arthralgia, eosinophilia, splenomegaly and lymphadenopathy. Let's see in detail about the Arthur's reaction. It's a localized inflammatory reaction, usually an immune complex vasculitis of skin of an individual with circulating antibody. Large immune complexes form due to excess of antibodies, which will precipitate locally in the vessel wall, causing fibrinoid necrosis. Injection of an antigen can lead to an acute Arthur's reaction within 4 to 8 hours. Localized tissue and vascular damage result from accumulation of fluid and RBC that will be resulting in edema and erythema. Severity can vary from mild swelling to redness to tissue necrosis. Examples of Arthur's reaction includes injection of anti-tetanus serum, in farmer's lung disease, in insect bite. Initially it will be having a rapid type 1 reaction. Later, after 4 to 8 hours, typical Arthur's reaction will be developing. In the case of ulcer, and also in insulin-dependent diabetes mellitus. And then in systematic circulating immune complex disease or serum sickness, it develops when antigen is intravenously administered, resulting in formation of large amounts of antigen-antibody complexes and their deposition in the tissues. These circulating complexes can't be cleared by phagocytosis and can cause tissue damaging type 3 reactions. And this will be resulting in antigen antibody complexes being deposited at different tissue sites containing basement membrane exposed to circulating blood. Following this deposition, there is acute inflammatory reaction and activation of complement system with elaboration of chemotactic factors, vasoactive amines and anaphylatoxins. These all cause type 3 hypersensitivity reactions. Examples of circulating immune complex diseases are skin diseases and various forms of glomerulonephritis. And other conditions that is caused by type 3 hypersensitivity include infectious diseases like meningitis, hepatitis, mononucleosis, and drug reactions like allergies to penicillin and sulfonamides, and autoimmune collagen diseases like systematic lupus erythematosus, that is SLE, and rheumatoid arthritis. And this flowchart shows the overall reaction that is taking place in local or systemic immune complex diseases. You can see that when an antigen is introduced into the body, antibody is formed and this together form the immune complex. There are small molecular soluble immune complex, intermediate molecular soluble immune complex, and large molecular insoluble immune complex, which will be eliminated by phagocytosis. The intermediate soluble immune complexes will be depositing on the basement of capillaries and they contain and activate the complement system, and the activation of complement lead to the release of inflammatory molecules, and there is basophils and mast cells which release vasoactive amines which increase vascular permeability and eventually will lead to edema. And there is infiltration of neutrophils, phagocytose complex, and release the enzymes in lysosome that will be resulting in tissue injury. And the leukocyte platelet thrombi are formed that reduce the blood supply and lead to tissue necrosis. Symptoms of serum sickness include fever, limb adenopathy, arthritis, endocarditis, urticarial rashes, abdominal pain, nausea, vomiting. Diagnosis of type 3 hypersensitivity involves examination of tissue biopsies for deposits of immunoglobulin and complement by immunofluorescence microscopy. The presence of immune complexes in serum and depletion in the level of complement are also diagnostic. Treatment includes usage of anti-inflammatory agents. Let's see what's happening in other immune complex diseases. The first one is hypersensitivity pneumonitis. In this, the inhalation of antigens into lungs stimulate antibody production, and subsequent inhalation of the same antigen results in formation of immune complexes that activates complement. Another one is the glomerulonephritis. In this, the immune complexes in the blood are deposited in glomeruli. Damage to the glomerular cells impedes blood filtration, and this will be leading to kidney failure and ultimately death. Next one is the rheumatoid arthritis. In this, the immune complexes are deposited in the joint and it really result in release of inflammatory chemicals. The joint begin to break down and become distorted. It's treated with anti-inflammatory drugs. This image shows the crippling distortion of joints. It's a characteristic feature of the rheumatoid arthritis. Another one is the systemic lupus erythematosus. In this, autoantibodies against DNA result in immune complex formation. Many other autoantibodies can also occur against red blood cells, platelets, lymphocytes, muscle cells. You can use immunosuppressive drugs to reduce autoantibody formation, and glucocorticoids could reduce inflammation. And this image shows the characteristic facial rash of systemic lupus erythematosus.